Hi, welcome to Indy Talks, produced by the Hudson Independent. My name is Barrett Seaman. My guest is George Yancopoulos, who is the President and Chief Scientific Officer, as well as the co-founder of Regeneron Pharmaceuticals, which is right here in the river towns across in Tarrytown, Sleepy Hollow, Eastview area. Regeneron has about 9,000 employees worldwide, as I understand it. They have 9 FDA-approved drugs. I think most of them are the product of Dr. Yancopoulos, who either developed them themselves or oversaw their development. And they have another 30 drugs that are in development. The company has won multiple awards for being a good and responsible company to work for. And the very good news for us here locally is that they are committed now to spend $1.8 billion to expand in this area. And in the process of doing that, creating 1,000 new jobs. So, Doctor, what I'd like to start asking you is what's going to be happening in those new buildings? And what are the 1,000 new employees going to be doing? What sort of jobs will be you offering?
Well, they're all going to be high-tech type jobs. We're going to be hiring, as you said, almost 1,000 people, and we're going to be expanding our lab space by almost 1 million square feet. And in that, we're going to be putting in what we call preclinical manufacturing. All of these medicines, new medicines that you talk about, they have to be produced, and they have to be produced at scale. We have manufacturing facilities, one in upstate New York near Albany and Rensselaer. And we actually have one in Ireland. And we, in Tarrytown, prepare all the processes before they get up to that largest scale that is occurring in our manufacturing site. So one major thing that we will be doing is building space capabilities and hiring highly technical personnel to be able to develop the processes to be scaling up our medicines. We're also going to be hiring a lot of scientists, the ones who do the groundwork, the background work to both do the science to justify the medicines that we're developing, or actually making the early versions of the medicines and testing them and so forth. Right. So it's all going to be highly skilled personnel who are going to be actually doing a lot of the science that we're already doing, enabling us to do more, and also learning to scale it up and developing the processes that are going to allow us to then move the medicines once they're ready to our large-scale manufacturing facilities in upstate New York or in Ireland.
Right. So why here? You've got other facilities in Ireland, as you said, and upstate. Why not expand in those places rather than come here to Tarrytown?
Well, a lot of what we've learned over the years is that communication is so important. You need face-to-face interactions. You need to have scientists working closely together in order to do the best science, in order to have the best sort of brainstorming, in order to have ideas really bouncing off each other. And so we've chosen the more people that we have within where we have our major R&D headquarters, the more people we have as close to proximity as possible working together, the better the interactions, the more the efficiencies are, the more the ideas bounce back and forth and get better and better as more people are involved. So we want to keep things together. That's worked well for us up until now. And this area has been very good for us. It's, as you all know, it's a great area to live, to raise families. Our people love it here. And so we're just hoping to continue the magic that we've built here over the last 30 plus years and just add a little bit more, personnel to that effort.
Right. As I understand it, you do a lot of work with schools. You've got a Regeneron Science Talent Search. I wondered if that isn't something that was inspired by your own winning of the Westinghouse Talent Search when you were a high school student. How active is that going to be, and will this expansion affect your relations with local schools?
Yeah, as you said, we are very active in promoting all sorts of programs for STEM education. As you said, for many of us at Regeneron, not only me, but we all started in school, being inspired often by some incredible teacher who recognized that we might have some ability in science and worked with us to build on that initial interest and that ability and turn us into scientists. As you said, when I was in high school, I was lucky enough, I was growing up in New York City. I was going to the public schools, lucky enough to take a test and get into what was then the Bronx High School of Science, still the Bronx High School of Science, one of the greatest public schools in this country. And the teachers there noticed a talent and an interest and got me involved in science projects. And it was then called the premier science competition in the country, was sponsored by Westinghouse. It was called the Westinghouse Science Talent Search. And certainly seeing how in that school, Westinghouse Science Talent Search winners were viewed like the top football jocks. They people would whisper as you saw somebody walk down the hallway and say, that person won a Westinghouse. Oh my God, they're going to go on and do something amazing in life. And that inspired the next generation of kids like me when I was just entering the school, saying, what is this? I want to do this. Maybe I can be one of the winners. And I was lucky enough because a teacher recognized the ability and the talent, and Mrs. Strom and Mr. Schmuckler, they really helped guide me. And I ended up being lucky enough to participate, compete, and be a winner in the Westinghouse Science Talent Search. And it is unbelievable to me that all these years later, that Science Talent Search is still going on. It's still the premier science competition for high school students. After Westinghouse, Intel took it on. It was the Intel Science Talent Search. And now we've taken it on. So to me, it's really a full circle story. The actual science competition that sort of got me started, that gave me the confidence and the inspiration to actually become a scientist. Our company that we started is now the sponsoring company for the Science Talent Search. And it's not only the Science Talent Search, the other major science competition is ISEF, the International Science and Engineering Fair. That was also sponsored for many years by Intel. And when they stepped away, we chose to take that on as well. So we're the major sponsor now of the premier country and worldwide science competitions. We're very proud of it. And we think it's critical to be inspiring and engaging that next generation of young people who we hope are going to just, stand on our shoulders and take it to the next level and make even bigger and greater discoveries and help with all the existential threats that we know. We hope to be part of the process that's going to help engage, inspire the best young minds to become scientists and take on these challenges that mankind needs to survive.
Right. Getting back to the company, unlike what most people think of as big pharma, when they think of companies like Pfizer and Eli Lilly, Regeneron doesn't seem to have much of a commercial. It's not a commercial producing drugs sold at the retail level. So you don't have big marketing or advertising departments in your company. You're mostly internal things that go directly to doctors and hospitals. So how does a company like that go about pricing your products? I mean, you're a very successful company, but in the end, how does that economically work?
Yeah, I mean, you bring up a couple great points. We are proud of the fact that we are very different from certainly the so-called big pharmaceutical companies, but also most other biotech companies. A lot of these companies, what they do is they go out and they're looking for opportunities, and they license in either from an academic center or from a smaller company, something that can turn out to be an opportunity, that can turn out to be a drug, a treatment that can help people. We're very different. We're very proud of the fact that we're the only major biopharma company in the world that was started and still led by physician scientists, myself and my longtime partner, Len Schleifer. And that it's science that really drives everything that we do. And we're also the only company that you mentioned. We have 9 FDA approved medicines, okay, plus the 10th, which is garnering some of the most attention, is FDA authorized, not approved. That's our treatment for COVID, our antibody cocktail treatment for COVID. All of these were all invented and developed in-house by our own scientists using our own technologies that we had invented here. So we're very proud of that. We're very proud of the process and what makes us different. We're not a company, as you said, that's built on licensing in or making ourselves a commercial success. Our success depends on our science and our technologies delivering important new breakthrough medicines that make a huge difference in patients' lives, whether it's the leading treatment for blindness around the world, the leading biologics treatment for allergic diseases like asthma or atopic dermatitis, multiple treatments for cancer, as well as other diseases like heart disease, or whether it's our recent advances in treating infectious disease with antibodies, where we're now recognized as the world leaders, first where we came up with a cure for Ebola, and now we've come up with this very important treatment for COVID. Right. In most cases, we work very hard in terms of the pricing to deliver what we believe is value-based pricing, pricing that's fair based on the value that's delivered by the medicine. And often we are lauded by independent organizations that monitor this based on the fact that from their perspective, we very fairly price our medicines based on the value that they're actually delivering. Now, importantly, for example, the COVID treatment is actually based on an agreement that we made with the government. We sold it to them in bulk at below market cost, so that then they could deliver to all the patients who need it entirely free of charge. Right. So the COVID monoclonal antibody treatment, RegenCov, is being made available to all Americans free of charge by the U.S. government.
Right. Now, but it's at a stage right now, it still has not received full FDA approval. Am I correct on that?
It's authorized under FDA authorization the same way the vaccines are and so forth.
Emergency.
Of course, right. And of course, we're going through the process of that ultimately we hope will lead to a full approval. But as you know, because of the incredible urgency and the timings, the government and society recognized and realized that there was not time to go through the standard process before trying to make these available to help all the people who need them. And as you've probably been following, just in recent weeks with the latest Delta surge, there's been an incredible need and an incredible demand for our treatment, as it's one of the few treatments that's shown to be effective, that can actually keep people who are at the early stages of disease from progressing to serious disease and hospitalization. And we also have phase 3 evidence that it helps even people in the later stages of diseases. So it's really potentially an important treatment approach for those who are actually infected, they're actually sick. And we've recently also gotten an extension in our authorization, not only for people who are already infected, but people who have had already a high risk exposure or are at high risk of having an ongoing exposure because, for example, they are in a setting, an institutional setting, such as a nursing home or a hospital or so forth, where they're going to be very likely to encounter infected individuals. So that's called post-exposure prophylaxis. Right. So these are all important ways in which our RegenCov antibody cocktail can be helping people, even either those who are infected or already symptomatic, or preventing it in the people who have had these high-risk exposures.
Right. What gives you the confidence that your antibody cocktail can keep up with the variants as they come around? You've had enough exposure now to the Delta variant to know how it's doing there. So what happens if the Lambda or the right up to the Omega turns out to be a killer thing? How can you keep up with that?
Well, this was an incredibly important question that we were probably the first people and the only people in the world to really think about and take account into our thinking when we were designing our medicine. Our whole program was designed by an incredible scientist and leader of our infectious disease group, Christos Kyratsous. And when we started early on, we recognized that there was going to be the possibility of variants emerging. That it had to be a necessity that these would happen. and that we have to be prepared for the eventuality that the nature and immune system would, through what is called natural selection and natural immune selection, select for variants that would get around therapies. And in fact, I remember in the early days cautioning the FDA and cautioning other pharmaceutical companies that were in the game, where they were trying to develop single individual antibodies that I thought it was actually very dangerous, because the antibodies themselves as single antibodies could actually potentially help select for these variants that we were afraid of. Back then, I was accused actually of fear mongering. As it turns out, of course, I mean, everybody should have realized, I mean, this is the history of every virus. We went through this with HIV. The initial treatments were single treatments, and then people got smart enough to make cocktails. And the purpose of a cocktail is you now are hitting the virus at multiple points. So a single mutation, a single variant can't get you escape. So that's why from the beginning, we created a cocktail of multiple antibodies. And it turns out that even if the virus now selects and in some way might escape one of our antibodies, the other one will kick in. The good news for us right now, for example, for Delta, is that none of the mutations in Delta affect the binding or the potency of either of the antibodies in our cocktail. So we're in good shape. So the reason we made a cocktail is we actually predicted the exact variants that would emerge. And we created a cocktail that we thought would be resistant to the variants. And so far, so good. But just in case, we are also developing, and we'll be testing in the clinic, follow-on cocktails. So God forbid there's future variants that somehow manage to evade our first cocktail. We will already have a second cocktail and possibly even more in place if that situation were ever to occur.
So your current one is a binary. It's got a 1-2 punch exactly against the variants. But what you're suggesting is that you can change the ingredients of the cocktail going forward if you need to.
Yeah, we have a completely different 1-2 punch that we've designed. And so if, God forbid, mutations, variations in the virus ended up making it weaken the effect of our cocktail, we have a completely different cocktail that can come to the rescue, hopefully.
Is that a problem for the vaccines? Do they have the same flexibility?
Yeah, it's a little harder. Now, of course, I mean, you know, we don't think, unfortunately, a lot of people are sort of, you know, talking about vaccine or treatment. I mean, we have to recognize that these are complementary tools that we need to give the medical system to be able to appropriately fight against this virus. The vaccines obviously can provide generalized immunity to a lot of people, and they do so by generating antibodies in the body. On the other hand, it's hard to generate the perfect antibodies in every single human being. And that's where our antibodies can come in. Essentially, what we've created outside of the body are exactly the sort of antibodies that you would want to generate by the vaccine. But the vaccine is trying to address a problem for hundreds of millions of people. There will always be some people, either because they're immunocompromised or for some other reason, who are not going to respond well to the vaccine. And essentially, our cocktail is a souped up backup for that, because it's essentially like giving them the most perfect vaccine type of antibody response you could expect, but we're providing it in a vial and in a tube where we can inject it directly into you. So there will be people who will get great protection from vaccines, but unfortunately, there will be people who will not. And some of those people, if they get infected, may get sick and in fact, progress to serious disease. But the good news is, for these sorts of people, there's now a backup, an insurance policy, which is our available treatment. And particularly, we believe, and we're talking to the FDA about this now, you heard about this third booster for immunocompromised people. Right. The estimates are there are about 10 million people in the United States who, because they've had a variety of cancers or variety of treatments or variety of genetic conditions, are not mounting after 2 vaccinations to either of the mRNA vaccines measurable vaccine responses. Right now, a third booster was just authorized for these people, but the evidence is actually weak that that third booster is going to help these people at all. And what we're talking now with the FDA is our antibody cocktail is the perfect cure, the perfect substitute for these people having the inability to mount their own antibodies. We can give them those antibodies. We've now done studies that show that, for example, we can dose people a simple injection once a month, and that can provide these very high antibody levels that, if anything, should be even more protective than a vaccine. So we hope that the FDA will recognize this and in the short term, authorize our antibody cocktail, for example, for the 10 million people in America who are doing a poor job of responding to vaccine. I think it's important to point out that a little disappointing to us, other countries, for example, the United Kingdom and France, have already authorized our antibody cocktail treatment. And the FDA, we hope, will follow shortly thereafter. But we are disappointed that these other countries made this recognition, is making this available to their immunocompromised populations before we have the opportunity to help our own citizens here in America.
Yeah. You know as well as anybody, there was a controversy last year when Donald Trump was able to get the Regeneron antibody cocktail, and nobody, there were thousands and thousands of people who were dying because they didn't have access to it. So, and I'm not suggesting that this is a decision that Regeneron made its own. There were probably a lot of people involved in that decision to do it. But what do you recommend in terms of fixing the system so that you can get these treatments out to as many people as possible, as soon as possible?
Right. What you're referring to the fact is that President Trump was given our cocktail before it was formally authorized under what is known as the compassionate use mechanism.
Yep.
It turns out that he went through the normal compassionate use mechanism. That's designed, though, only for tens or hundreds of people, because that's not a process by which you would roll out something that's authorized or approved to thousands or tens of thousands or hundred thousands or millions of people, as we're doing either with our treatment or with the vaccines. Mm-hmm. It's not an equitable system, as many people have pointed out. Most people don't know how to navigate it. They don't know how to get to the compassionate use system. Obviously, people who are in a position such as the President of the United States know, they have people around them that know exactly how to navigate that system. But unfortunately, it's not an equitable system that can be used to deliver to all the many people who need it. And so this is why we need the formal authorization by the FDA. I can tell you that hundreds of people who are immunocompromised are right now getting our antibody cocktail chronic prevention because they weren't able to make antibodies to the vaccine. We don't think that's a fair system. It's obviously, very biased to the type of people who know how to navigate it and get the drugs through that system. And we think a far fairer, more equitable system would be getting formal authorization by the FDA. We believe the data warrants it. Clearly, other countries and regulatory agencies, such as the MHRA in England or now in France, have agreed. And we can only hope that that the FDA comes to the same conclusion and makes it more widely available under authorization as we feel it should be.
Right. Your antibody cocktail, something that could be used to make a dent in the vaccine hesitancy population that's out there?
Well, I think that this is a concern, which is why I think policymakers and top government officials, they have not been, I think, as loudly talking about the available treatment, because I think they're afraid that once people knew that there's a powerful treatment out there, it might actually promote more vaccine hesitancy. People might say, hey, maybe I don't need the vaccine. Let me wait. If I get sick, I know I can get this treatment. So I understand that thinking. But I think that we have to get the information out there. Just because some people might be pushed to avoid the vaccine if they know there's a treatment out there. On the other hand, people can get sick. Even people who've been fully vaccinated are getting sick now. And we have to make it clear to them that, God forbid, if they get sick, even if they've been vaccinated, there's a treatment that's been shown in phase 3 trials to be highly effective. Our studies have shown that in people who are infected and not yet in the hospital, we can prevent hospitalization or death by a little bit more than 70%. That is a huge effect, and it could really keep a lot of people from having to go to hospitals and from getting very sick and from possibly dying. And we have to get that information out there more powerfully.
What is your prediction, best you could do it, on the course of the pandemic from here?
I have to admit that it's been very scary. I think, like a lot of people, I was hoping, I was maybe dreaming that this concept of herd immunity would prevent transmission and would keep this virus, in control, and would see, slowing down of spreading and so forth. I think that we're all learning right now that though vaccines hopefully will continue to play an important role in preventing people from getting seriously sick, they're not doing as good a job from blocking infection per se. And so people who are vaccinated can still get infected, they can still get high virus levels, and they can still pass it on.
Yes.
What that means, we're all hearing these terms of breakthrough infection and so forth. What that means is that this virus is here to stay, that it's not going away. Even people who have immunity, either from a vaccine or who've been previously infected, can get infected again. This is going to create a continuing reservoir for new variants to emerge. So, I had hoped, like everybody else had hoped, that herd immunity, widespread vaccination together with some natural immunity would really maybe get close to eliminating this problem. I think that we may be dealing with something that we're going to unfortunately have to learn how to live with, which is going to necessitate ongoing vaccine developments, abilities of new vaccines to create better resistance or better immunity against these variants that are emerging. And we're going to continue to need these treatments for the people who get sick. And so, humanity, I think, is going to be in a battle for a while here, trying to fight back. And we're going to need all the tools at our disposal and, engage the best and the brightest, and maybe the next generation of scientists to maybe one of them in the future is going to come up with something that can really put this behind us. But for the foreseeable future, I think this is going to be something we're going to have to be learning how to deal with.
Wow. I wish I had time to get into other areas of research and ask you a prediction on, what's the next big promising thing for cancer, for whatever it is out there that plagues humanity. Unfortunately, we don't have time, but maybe we could follow up on that in another way.
Sure. Maybe I can leave you with the thought that the big new area for Regeneron, we've been leaders in the world of biologicals and antibodies, such as antibodies for blindness, for allergic diseases, for cancer. But one of the big next areas are genetic medicines. And we've just made recent announcements about some exciting new developments that we and our collaborators have made in manipulating the genome in order to help humans fight back against disease. And that would be a great future topic to possibly discuss.
That's a good positive note to end on. Thank you very much, Doctor. I appreciate you taking the time.
Thanks for your interest.
Sure.